Hello everyone, welcome back to my channel, and today again on set we have Dr. Christina Sule. And before I let you know guys the topic you're going to talk about today, I wanted to say hi.
Hi everyone, my name is Dr. Christina Sule. I'm a consultant obstetrician, a general and cosmetic gynecologist at Allora Medical Practice, and thank you so much for having me once again.
Welcome. It's always a pleasure. For me, I really enjoy these sessions. I learn a lot, as Dr. is here to teach you. We share information, we learn from one another. And today we're going to talk about fibroids. It's a very, very common condition with women. I've had so many people who've had the condition, who are experiencing it. And the thing is, nowadays, even women in their 30s do get fibroids. And today, Dr. is going to talk about that. I'd like her to define what fibroids are before we can delve deeper into the condition.
So a fibroid, a uterine fibroid, is a smooth muscle growth. Generally, it's benign, so it's not cancerous, although there's a very tiny chance that it can become cancerous, about a 0.26% chance that it can become cancerous. And so it's a smooth muscle, benign growth in the uterus that is usually triggered to increase in size by estrogen. So the more estrogen that is in the surrounding area, the more the fibroids are likely to grow. So that's basically what a fibroid is.
Okay, it's very interesting. That's very interesting. And when women talk about having fibroids, I think nowadays, I don't know, for lack of a better words, it seems like, it's a casual thing. I have fibroids, my friend has, it's something that is not, we don't need to worry about. So I think today we are going to talk about being able to judge, do I need surgery or not? And I don't think that's a judgment you should leave to yourself. I think you should go see gynecologist, and then they decide should we take it out or not. But before we go into that, I'd like us to discuss some risk factors that are associated with the uterine fibroids.
Yeah. So the people who are more likely to have fibroids are women who haven't had children. That's one of the risk factors. It's called nulliparity. Women who've never had a child before are at a higher risk than women who do have children, although I still do get quite a lot of patients who've had children and still have uterine fibroids. But nulliparity is a risk factor. One of the other factors is just being African. Women who are African tend to have fibroids much more than Caucasian women and Asian women. So being African in its own is a risk factor. And then the frequency of your periods. So women who tend to have maybe 2 periods a month or very short cycles are actually more predisposed to having fibroids than women who don't have frequent periods. Obesity is one of the risk factors for uterine fibroids. So if you're obese, you're definitely at a higher risk of developing uterine fibroids than a woman who is of a normal BMI. Another risk factor is having it in your family. So genetically, there are some women who are more predisposed to having fibroids because their mothers or aunts or maternal relatives have had uterine fibroids. And then just being in the age of 40 to 50 years also puts you at risk of having uterine fibroids, although there are women, as you mentioned, who are getting it younger and younger right now. So those are some of the things that put you at risk for fibroids.
Okay. So Dr. if let's say, for example, I might have the condition, what are some of the symptoms associated with uterine fibroids? How can I know, okay, I'm suspecting I have this and I need to go seek medical help?
So as a general rule, I say whenever you have any kind of reproductive system symptom, you should generally see your gynecologist for that. But some of the things to look out specifically for fibroids are heavy bleeding. Women who have very heavy menstrual bleeding definitely need to see a gynecologist to see whether it could be uterine fibroids or not. Women who have very painful menstruation need to see their gynecologist because it might be fibroids. Of course, it might be something else like endometriosis, but heavy bleeding, painful bleeding can be fibroids as well. Women who have pain during sexual intercourse, women who have a distended abdomen. So you feel like there's a mass in your abdomen, or your abdomen tends to be quite distended because it could be that your uterus has become so big that now it almost looks as if you're pregnant.
That's what I wanted to even ask before you said, because some people, some women say, after I had fibroids and when I removed them, my stomach size reduced and flattened a little bit, so that's quite interesting.
Yeah, so abdominal distension is one of them. Pain during sexual intercourse, it could be just because of the weight of the uterus, or it could be because you have a fibroid even in your cervix, because we can't have them there, and that can cause quite a bit of pain during sexual intercourse. Women who have pelvic pain even when they're not having a period, so your period is over and you still continue to have this pelvic pain, that could be fibroids.
The pressure of the mass.
Exactly. And then women who have symptoms, what we call pressure symptoms of fibroids. So if fibroids are in your uterus and they make your uterus heavy enough, your uterus can lie on your bladder or lie on your rectum or lie on your urinary tract, and this can cause symptoms like urinary tract infections, constipation, frequency of urine, you're constantly wanting to urinate, and it could just be the fibroids. Or one of the symptoms could be like lower limb swelling, which is something that seems completely unrelated, but when your uterus gets very large and heavy, it can lie on one of the vessels that's leading to your lower legs, and because the return of the blood in the veins becomes poor, this leg starts to swell, and that actually can be very dangerous, because if a clot forms in one of those legs and dislodges, it could go to either your lungs or your heart or your brain, and it could be fatal. So you need to take your symptoms very seriously.
And like Daktari is saying, anytime you feel anything different with your body, that's why it's important to listen to your body. Anytime you feel something is not right, it's better safe than sorry. Make sure you go see a doctor. What is the worst? We do tests, we do ultrasounds, and we find that you're okay, and it could be something that can easily be solved, you know. It could just be maybe an infection, you know. So those are some of the symptoms. And if you're someone maybe who's had fibroids before and you had none of those symptoms, like Dr. always says, everyone has different manifestations of certain conditions. So Dr. was just talking about the common symptoms that she has seen over the years as she's practiced her craft. Before we move on to the different types of fibroids that we have, infertility is also something I've heard that can be a symptom of having fibroids. Is it true?
Yeah, that's true. Infertility can be a symptom of uterine fibroids, and it usually happens, for example, when you have a fibroid that is sitting at the point at which the fallopian tubes join the uterus, so it kind of blocks the ovum from entering the uterus, or from fertilization from happening. So yes, you can have infertility. At the same time, you can have fibroids that are inside the uterus that distort the cavity of the uterus, or sit in the place where implantation is supposed to happen. So you find implantation cannot happen within the uterus, and that can lead to infertility as well. And remember, women who have uterine fibroids tend to have very heavy bleeding, and they can have painful sexual intercourse, which makes them have sex much less.
So then their chances.
Exactly. So their chances of getting pregnant are much lower, and these are just amongst the other factors that can cause infertility.
Okay. So that's one of the symptoms. I know right now we need to go ahead and talk about the different types of fibroids. And Daktari here has, what is this called?
It's a uterine model.
It's a uterine model. So she can show the different types of fibroids that women can have.
Okay, so basically you can have a fibroid on the outer part of the uterus completely, or you can have one that's inside the muscle layer of the uterus, like this one over here. Yeah, so you can have it like just seated inside the muscle of the uterus, or you can have it completely inside the uterus like this one. And these are the ones that distort the cavity of the uterus. These are the ones that are more likely to cause infertility, and they can also cause recurrent miscarriages, because when the implantation has to happen inside the uterus, you find this fibroid is constantly causing a problem in terms of implantation. At the same time, fibroids like this, if you have an intrauterine contraceptive device, they can tend to shift your intrauterine contraceptive device
and move it.
Which is which is
then
not.
I'm going to have a baby.
Which is yes, but remember, it's still causing infertility. So it can cause shifting, which is not related to fertility, but it can cause the shifting of an intrauterine contraceptive device.
Could it be some women do have are able to conceive and are pregnant and they have fibroids?
Yes.
Okay.
Yes, you can get pregnant when you have fibroids. Just because you have fibroids does not mean that you can't get pregnant. It's very possible, but of course there will be some complications.
Yeah, and also require a lot more care.
Yes, they require a lot more care. They are more likely to go into preterm labor. Women who have a fibroid and a pregnancy, because as the fibroid grows, because there's a lot of estrogen that's produced during pregnancy, the fibroid can tend to grow and press on the amniotic sac and cause it to open up earlier than it ideally should have. So that can cause preterm labor. At the same time, it can cause, depending on how big the fibroid is, it can tend to squeeze the baby a little bit, which does not allow the baby to move ideally as they should. And so sometimes they can, yes, because of the limited space that's there. Sometimes that can cause a bit of muscular issues with the baby. At the same time, it can cause bleeding during pregnancy, because you can have a fibroid that's in the lower part of the uterus. It can make the placenta attach in the wrong place during pregnancy. So instead of it attaching at the back top part of the uterus, it tends to attach in a different place because there was a fibroid there. And remember, if the placenta attaches in a different place, it makes the attachment of the placenta very weak. So the placenta can disattach before labor has started, and that can be a bit of a problem. So a pregnancy that has a fibroids and big ones is a high-risk pregnancy and needs to be managed closely.
And that actually does that too, guys. I think people see the hair and they just see the cosmetic side of it's Eva, it's Oshot, but most of her days are spent in theater. So I think it's another side of Dr. that people don't know about, just because she looks pretty with makeup and the wig and everything. She does a lot of maintaining such kind of high-risk pregnancies. She does surgical procedure. So that's what mostly her days are all about. And to be honest, for me, I'm an advocate of women who just casually say I have fibroids and it's fine and we are moving on, because maybe I have experienced it at home personally with someone who's very close to my family, and she nearly died because of fibroids. They were so big. I remember calling Dr. I was so worried. She just saw that the size, and she was like, this one is to come out, and she was in so much pain. And when they were removed and I saw it on the table, I was like, oh my God. So I think Dr. maybe you can go into when do you need surgical intervention when you have fibroids?
So not every woman who has fibroids needs surgical intervention. What I usually say is this: if the fibroids are not causing significant bleeding, if they're not making you infertile, and if they're not so big to cause your uterus to become so heavy that it's now lying on another organ or infringing on any other organ, then you really do not require the surgery. Also, if you're very close to menopause, then really you don't need a surgery to remove one or two small fibroids, because remember, estrogen is what makes fibroids grow. So and during menopause,
from estrogen, and it will grow, I understand, as fast as it would if you're not in menopause.
Exactly, like if you are, say, 30, for example, if you got pregnant, the fibroid would tend to grow. And so if you're very close to menopause, you're not having much bleeding, it's not causing you infertility, it's not infringing on any other organ, then you ideally do not require surgery. For example, if you have 1 or 2 fibroids and they're 2 centimeters, they don't really need to be removed, right? But now, if your fibroids are large and causing you significant bleeding to the point that you have anemia, which is another symptom,
it's another symptom
that you can get, or if your fibroid is blocking your fallopian tubes or causing any kind of infertility, or now your fibroid is so big that it's lying on your ureters and your kidney function is starting to worsen, then you need to have the fibroids removed. Ideally surgically.
I know someone who had really big fibroids, and as a doctor was going in to do the surgery, was like, I'll really try to save your uterus. Sometimes they don't save it and sometimes they do. So when the doctor is going in, they usually prepare you mentally that I hope I can't save your uterus, and sometimes you just can't, because here we are saving life of someone who's already alive. So there are those. Do you experience those kind of patients?
Yes, sometimes we do. Sometimes we go in to remove fibroids. Ideally, we want to remove them to restore, to make sure the bleeding is not happening, to restore fertility, to make sure the uterus is not bothering any of the other organs. But sometimes the surgery can be accompanied with a lot of blood loss.
Yeah, they lose a lot of blood.
They do lose a lot of blood, and so sometimes you're forced to remove the entire uterus. Or if the uterus has, over 40 fibroids and is completely distorted, and maybe the
40?
Yes, there've been even more than that. And for example, the client has already completed her desired family size, then sometimes we just go ahead and remove it. Sometimes patients come in and just remove the uterus to start with because they don't want to continue having children. We're not going in to remove fibroids, we're just going in straight to remove the entire uterus, which is a hysterectomy. So yes, we do get such patients as well.
You do get such patients. Okay, it's interesting because when the doctor was mentioning that, we were like, okay, how is that the fibroids related to the uterus? And now it makes sense. Yeah, okay. And so now we're going to go into the test, the diagnosis. How do you determine that a woman has fibroids?
Well, the good thing is that it's really easy to determine whether you have fibroids or not. And most of the time, a pelvic ultrasound is sufficient. Sometimes we do a vaginal ultrasound because remember, we can have fibroids in the cervix as well. So it's sometimes better to do a vaginal ultrasound in some situations. But most of the time, the pelvic ultrasound is more than enough. It'll tell you where the fibroids are, how they're situated. Are they inside the uterus, in the muscle? Are they outside? The ultrasound will also tell us the full capacity of the uterus, like how heavy is it. It'll let us know, is it infringing on any other organ like the ureters? So that's very important. And so an ultrasound is the basic test that we do. The other test that sometimes we do is a magnetic resonance imaging or an MRI, and that usually helps us to map out the fibroids right before we go to the surgery. Exactly, because sometimes we do an ultrasound and yes, it tells us about the fibroids,
but where is it
but sometimes some are hidden, and so we don't want to go into the surgery blindly. We want to know where we are going, which fibroid we're looking for, how we're getting it out, because sometimes they can be in a tricky position to remove. Sometimes we do a blood test, like a hemogram, just to see whether you have anemia and also to prepare you for the surgery, because if your hemoglobin is low, then it'll be difficult to have the surgery. You might need a transfusion.
So the person who I'm telling you about, we had to have blood standby, and so we all donated in the family because they needed blood. You've mentioned something that has made my mind remember, there are people who they do get the procedure, but it is done laparoscopically. Laparoscopically. And then there are others who are cut. So explain to me
who gets what,
because there's someone like the person who experiences it, had to be cut, like her cut is across, because the only way the doctor could have removed most of it.
Well, yes, it depends on the size of the uterus. If the uterus has become very large and the fibroids are very big, then it's possibly better to have an open surgery so that it can allow us to access the fibroids easily and remove them. However, some women who have significant symptoms but their fibroids are not too big, you can have a laparoscopic or a minimal access surgery. So it really depends on where the fibroids are situated, how big the uterus is, how many fibroids there are, what problems they are causing. Because remember, we mentioned that some fibroids can be inside the uterus. So for those patients, they even require a completely different procedure called hysteroscopic removal.
I think that's the one.
Which is where we go with a camera into the uterus and then we remove the ones that are inside the uterus.
That's the one I'm talking about.
So that's different because the fibroids were inside the uterus. When they're inside, they have to be removed hysteroscopically.
I think that's the one I'm talking about, because the doctor was trying to explain why they have to go inside and cut. And when I saw the cut was from here to here, and I said, you know what women do goes for a lot, man.
So with hysteroscopy, you don't actually cut anything. You just go through the vagina and the cervix, remove the fibroid inside the uterus, and that's it. Now, for those who have a very big uterus, they have to get, like a really probably extensive incision. Yes, that can happen as well.
Okay.
And hysteroscopy is actually one of the investigations that we have. We also do additional investigations, such as we check your kidney function to see whether the fibroids could have been affecting the kidneys. As I mentioned, for some women, we have to check their lower limb veins to see whether they have a clot or not, because the fibroid has been, lying on the lower limb vessels for quite some time. So there are these tests that we call ancillary tests that we do, not just the ultrasound.
Okay, so extra test, just to know what the doctor is signing up for, how bad is this, So again, I always say, go to see a professional, seek first opinion, second opinion, until you're comfortable, you have all the information and knowledge. And at the end of the day, you're not living a quality life if every time your periods are coming, you're dreading it. For women who tell me, I bleed 16 days a month. I'm thinking you're bleeding 3 weeks, you know.
That's
sometimes it's 20 days and it's a lot of bleeding. They have anemia. I know women who've passed out because of bleeding, because they don't have enough, you know, blood in their system, circulation. So please, women, let us not ignore when we have fibroids. Let's not make it something that is common, you know, like something that, you know, it's fine, I can live with, unless a doctor has told you that you can.
Yes.
Yeah. So can we talk about the management of fibroids, and when the doctor comes in and says, okay, this can be managed and this one requires surgical intervention?
Yeah. So we do have different types of management of fibroids. We have medical management and we have surgical management. The medical management generally revolves around hormonal therapy. So we do have some medications, for example, things called GnRH agonists, which is basically injections that we give you to alter your hormones to decrease the estrogen. Remember, so that they shrink.
They thrive on
yes,
the
they
estrogen.
thrive on estrogen. That's exactly correct. So that they either stop growing or so that they shrink. And these are usually injectable medications that you get every month for 3 to 6 months. So you can get a 3-monthly one or a 6-monthly one. And so basically that's one of the ways. One other way is to have a hormonal intrauterine contraceptive device, the Mirena. It's actually one of the treatments for fibroids, especially if the fibroids are quite small and they don't need surgical removal and they're not, you know, causing the uterus to be very heavy. It is one of the ways that we can use to manage. There's also some medication which I haven't quite seen much in Kenya, but it's called ulipristal acetate, very common in the West. It can make fibroids shrink, and it's actually a very new and very promising treatment, medical treatment for uterine fibroids.
You know?
Some women are given hormonal medication that resembles male hormones so that the estrogen can decline and so that the fibroids can shrink. So there's quite a bit of hormonal treatment that you can receive other than actual surgery.
Yeah, but I'm sure when the doctor needs surgery is because of all the symptoms you've mentioned. You know, it's affecting your organs, affecting your quality of life. You have anemia, so the doctor decides it's easier, it's better and safer for you. We just remove them.
Exactly. And some patients decline surgery,
I
and it's
know.
their right.
And it's their right. Like I said,
right,
seek first opinion, second opinion, until you're comfortable with your diagnosis and your management and the treatment. You know, it's your right. At the end of the day, you're the one who is carrying it. You're the one who knows how it affects your life. So it's up to you. When the doctor gives you information and gives you a proper diagnosis, it's up to you to decide, are we on the same page? Do we agree on this treatment?
That's
or
true.
Maybe another option?
Yeah. And then we have the actual surgery itself, which we have myomectomy surgery, which is removal of the actual fibroids. Many times I find myself doing this surgery for fertility purposes. So women who want to have a baby and the fibroids are causing infertility, then we do the surgery to restore the fertility. But of course, as we mentioned before, you can have the hysterectomy to remove the entire uterus, or you can have hysteroscopic resection where we remove the fibroids that are inside the cavity of the uterus, and then we can have laparoscopic surgery, which is the minimal access surgery. Now with laparoscopic surgery, there's something that we do called mosellation, which is basically we go in with minimally invasive equipment, we remove the fibroids, but because we went in through a 0.5 centimeter hole, we have to chop the fibroid up into small pieces to be able to retrieve all those pieces and remove them. And there's some studies that have shown that that can be a little bit dangerous, because remember there's that chance of the fibroid being cancerous, which is 0.26%. It's a very small chance, but if there was cancer, then that chopping up process can cause it to spread. Exactly. So that's something that the patients need to be aware of, even as they're choosing to have laparoscopic surgery over open surgery.
Okay. So ladies, gentlemen, there, exactly, this is not only for women alone. You know, you have sisters, you have wives, you have nieces. I hope today you've learned more about uterine fibroids, and not only fibroids are not in the uterus, the cervix and many other places. The Terry has mentioned the different types of fibroids, and I just want to tell you, ladies, you are not alone again. There's medical help in this country. I will repeat and keep repeating that many things can be done in Kenya. You don't need to leave the country. Again, information is power. Remember to seek first, second opinion until you're comfortable with the diagnosis and the treatment. And before we finish, I want Shari to just say her last remarks, and maybe to encourage someone outside there who's going through this and they feel like, you know what, I don't have a solution, I can't talk about it, you're suffering in silence.
So what I'd want to tell people is definitely listen to your body, report to your doctor the symptoms that you have. Do not ignore them. Fibroids is a topic that's very close to me, and I know to you as well, Catherine.
It's very close to me.
And this is something that can really spin out of control and end up
Very
being
fast.
really, really bad. So I'd say listen to your body, report your symptoms, and do not be too reluctant to surgery if your doctor tells you that you need one. If you're looking for fertility and you end up having the surgery, please try and have your baby as soon as possible,
because they might grow again.
Yeah,
the
fibroids do grow back. It would be very unfortunate to have a surgery and then waste that time and come back a few years later with the same fibroids or worse and still not have a baby. So those would be my parting shots.
Okay. So until next time, I hope you've learned a lot. Until next time, guys. Bye-bye.
Bye.